Riverside County marking a grim milestone. An infant has become the youngest person to die from COVID-19. The child was less than a year old and was taken to the hospital after becoming ill. However, officials did not say if the infant had any other health problems. And that death comes as we deal with more than 65,000 positive cases across Riverside, LA, and Orange counties.
That's right. With the rise in cases and the hospitalization numbers, it's also been challenging trying to find a test, getting those results back in a timely manner. So here to help break things down for us is Dr. Richard Kang right now, Medical Director of the Pediatric ICU at Dignity Health Northridge Hospital. Thanks for being here today.
Oh, thank you for having me. Good morning.
Good morning. We keep hearing about these hospitals filling up. Nurses are saying this is getting bad again. We know that the Omicron variant is spreading among those who are vaccinated, not vaccinated. And a new study out this week shows again the severity of Omicron is lower than Delta. But that study also showed that among the 50,000 people they looked at, not one person was put on a ventilator, which is great to hear. So what's it like on the front lines at the hospitals right now? What are the conditions like?
So just the sheer numbers have started to stress the hospital system. Even though it does seem to be less severe, the number of new cases almost has tripled since last year when we were at our peak. So it is starting to stress the systems in the ER. And you can see the number of tests that are being done has also gone up as well, as it has been more difficult to find tests in the county.
Yeah, that is a big problem, Doctor. There's a lot of confusion when it comes to figuring out the time to get a test and how long you have to wait. We talked to somebody yesterday, said it took them 9 days to get the results of their test. What do you suggest people do?
So CDC still recommends if you do think you have been exposed or have been confirmed to be exposed, the optimal time is about 5 days after exposure, or obviously if you're starting to have symptoms, that would be the time to get tested as well.
And what's your reaction to this new California issued situation where if healthcare workers test positive, and they are not showing symptoms, that we're so short-staffed right now, they're being told you can go back to work?
So again, healthcare workers for the most part are vaccinated. And again, we know that if you are vaccinated, you're less likely to transmit the virus, even if you are an asymptomatic carrier. So unfortunately, these are the times where healthcare workers are in need, and we need to just keep moving forward as long as you're asymptomatic.
And Doctor, when it comes to people getting really sick who end up in the ICU, are we still seeing primarily people with pre-existing conditions and people who have not been vaccinated? Is that still what you're seeing?
Yeah, that's what we are seeing. Among the vaccinated, it appears to be very mild disease. Those that are getting sick again are similar to the previous waves where they have pre-existing conditions or are unvaccinated, like you said.
And I have a question. A lot of people are asking this, and I'm not sure if we even have the answer yet when it comes to this. We've seen so many different variants. We've seen people get Delta. We've seen people get the original strain. With so many people now getting Omicron, can they get Omicron again if it circles around, or is it likely to be another variant? Have scientists figured out how this is all working as these variants sweep the world?
And that's a great question. With the first wave, we did see reinfection with the same virus. So we're not. I think we're still early enough in this wave that we don't have enough data to know if people can get reinfected with the same variant. And one thing that we have seen definitely is that co-infections with other viruses, such as the flu, which is prevalent during this time as well.
Yeah, Florona, we've had a confirmed case of that, something else we have to think about. Dr. Kang, thanks for the great information. Let's hope we get through it. Good luck to you and your staff. I know it's got to be incredibly difficult right now. We appreciate all the hard work.
Thank you. Thank you for having me.